Yeah, so it's pretty standard. I've been doing it for a long time, so nothing new. And I've given this talk before, sometime during the pandemic. I can't remember when, so some of you might have seen some of the information, but this is the year 2025. So I think a lot of people know the information and they have questions, possibly, because there'll be new treatments that are always up and coming when we're dealing with medicine. So Parkinson's, everyone knows, neurodegenerative disease that affects, actually, interestingly, more men. So all my Parkinson's patients over all these years have been male patients, unless it was a female patient that had Parkinsonism, which is something due to, let's say, a drug that's causing um, the Parkinson's symptoms. So they don't technically have Parkinson's, but the cause of it that people don't realize it's both genetic and environmental. So genetic meaning that there is a family, possibly history of it, but it also could be something you were exposed to, and common things that you would be exposed to. Heavy metals, a common one that people talk about. Other ones would be chemicals such as pesticides, organicides, things that are in the environment. So you can't avoid it. So a chunk of it is, if there's a family history of it, yes, we pay attention to it. And in naturopathic medicine, we also do genetic testing. So you can actually find that out. So with Parkinson's, classic symptoms, tremors, muscle stiffness, poor balance, difficulty walking. But it varies from person to person. And because of that, you would need to change your plan. It's not going to be the same. So your plan might be different from someone else because for you, it's affecting simple tasks like getting up, getting dressed, going to work, versus other people, it's their mood that gets affected. So because it's very different for everyone, then your treatment plan will fall into one of these two, whether it's problems with movement or problems with their mood or a combination of it. So no one person in naturopathic medicine, the principles are treat the cause, not the symptom. So you have the symptom of the neurological changes, but what if there's also mood changes? So we need to address them. And we could use, as I was saying, acupuncture, but we can use natural supplements, which would be modified fatty acids, modified amino acids. The big one are going to be what are called antioxidants. So oxidants are what things, molecules that your body gets exposed to, gets into your body, and it damages the neurons or the um, nerves in the brain. And our job is to try and go in and repair that and prevent further damage in the person's brain. But there's no one specific cause for it's genetics plus environmental, so you can't pinpoint it. But the bottom line is that this, as most people who are listening in, dopamine being the main neurotransmitter that it's affected. And with the loss of dopamine, there's also a loss of the nerves because they've been damaged by these free radicals. The nerves or the brain tissue has been inflamed, and over time it starts deteriorating and so complex that you can't pinpoint one versus the other and say, this is what caused my Parkinson's. Not really, unless it was a drug or one of my patients, it's a motor vehicle accident they had in 1973. And so now they have, well, not now, they've had Parkinson's for 10, 15 years already, but they believe that that was the original inciting event. So risk factors, that's what we look for. Being men versus a female patient. As I said, most of my Parkinson's patients are men 50s, 60s, 70s, 80s. There's a genetic susceptibility, so there's a family history of it. It runs in the family. So if you have a parent or a sibling, brother or sister that has it, your increased likelihood. But this only accounts for 10% of the patients. There are certain genes that are involved with it, and they're called recessive genes, meaning that they're not necessarily going to show up. So just because you have the gene doesn't mean you're going to have that condition, but you can pass it on to a future generation, but that's still genetic, a small amount. But bottom line, that part of the brain called the substantia nigra that needs the dopamine in order to function is not doing its job, and you have all the symptoms. So, with chemicals, so what have you been exposed to? Namely, pesticides. And these pesticides are in um, common, like foods. It doesn't matter. So there is the dirty dozen that people talk about, or we have researched online. There's certain fruits and vegetables that have a higher amount of pesticides that's used in order to cultivate or grow it. But that's the environmental risk factor. But the other part of it is also your diet. Are you eating the right foods, things that have antioxidants, that have flavonoids, that have beneficial nutrients that help to repair damage? Are there nutrient deficiencies? So one common one that gets missed are the B vitamins as well as vitamin D, and food sensitivities, which is common ones that people don't think of, dairy, gluten. People say, oh, I think that is the case, but in naturopathic medicine, we don't play this guessing game. We do a blood test and we figure out which specific foods that are inflammatory versus the other ones that are non-inflammatory or beneficial to you. And the last one are hormonal imbalances. So as you can imagine, as you get older, your hormones start declining. So in women, it's estrogen and progesterone. For men, it's testosterone. And they haven't really pinpointed it because with Parkinson's, said it's multifactorial. So you can't really say this is affecting versus something else is not. So if that's the case, then our job is to find out the combination. It's like a jigsaw puzzle piece. We put it together and figure out what's going on in that patient. And the hormone could be even the anti-stress hormone called DHEA. So pesticides. So herbicides, pesticides have been implicated in Parkinson's disease. So they could be permethrin, it could be the organochlorines. So these are common pesticides used. Um, I I grew up in Asia, so in Singapore, and there was always spraying of DDT, for example, to get rid of the mosquitoes. So that'll be an example of the organochloroquines or herbicides that's used on plants. And now they use different ones versus in the 60s, 70s, 50s, they use other ones. Another one is MPTP, which is a neurotoxin. And they found it incidentally in the 1980s when IV drug users were using heroin and was contaminated with this. And that immediately triggered the Parkinsonism, so symptoms of Parkinson. Agent Orange, everyone knows about from the Vietnam War. So that was added to the list that could be causing or triggering a risk factor. So it's not a definitive, but it is one of the risk factors. And then the heavy metals, so manganese, so people that have been exposed to manganese, and these are the patients in the trades. So welding, they would be exposed to manganese. So it's not magnesium. So magnesium is another mineral that's for muscles to function properly. Manganese is a trace mineral that's used in metabolism. It's used in bone health. So you need some, but not to the point where at your job you could have been exposed to it, and that increases the risk for Parkinson's disease. Solvents such as trichloroethylene, that's used in dry cleaning, it's used in paint thinners, it's used in laundry detergents. So hopefully less and less in this day and age, the year 2025. But because Parkinson's is a long-term thing, it wasn't something that, oh, this one time I got exposed to it, and that's the one that is going to be causing it. And then the last one, the PCBs, the polychlorinated biphenyls, that was used for a period of time in the 50s, 60s, and 70s, and then got banned. And they were found to be in high concentrations in patients with Parkinson's. So pollutants that were found in the environment. So what can we do? So naturopathic medicine principles are treat the cause, not the symptom. Treat the whole body, not the organ system. And then doctors teach you, we're teaching you what's going on. We're trying to prevent it from progressing any further. So there's quite a few. As I said, it is dependent on you individually. So you versus your best friend versus someone else. It can vary, but in general, I put it in an umbrella that if you're doing these things, chances are you're going to be covering all bases. Okay, so with foods, you want anything that is what is called nutrient dense. So nutrient dense means it's packed with vitamins and minerals. So vitamins and minerals, you would find that in anything that's colorful, green leafy vegetables, colorful fruits like berries, anything that's, yeah, the darker the color, the better, because the more antioxidants that they have in it. And ideally, to avoid the pesticides, then it's going to be an organic fruit or vegetable. And then when they talk about high quality meats, again, depending on food sensitivities, you want the meat that is going to be organic beef, organic lamb, um, things that the animals weren't exposed to pesticides and chemicals, and that's what you want because you inevitably are going to be taking in these chemicals, and then your body ends up storing it away. So you want it as clean as possible. And then the other clean food is what we call whole foods. So things that you're going to cook at home, the whole food, like the whole vegetable, the whole fruit, the meat, etc., and not processed. So processed foods, they're processed because something has been done to it in order to put it into a package. And they tend to have the preservatives or chemicals that are added to it to maintain its longevity on the shelf. So trying to avoid that. Raw foods. So this one depends on the person. So with Parkinson's, some people will know that a common complaint or symptom is going to be constipation. So some patients do better with raw foods, so raw fruits, raw vegetables, because these colorful fruits and vegetables have these antioxidants that repair the damage. So they get rid of these things called free radicals. And think of free radicals as a golf ball that's bouncing around a room and it is damaging things. It's indiscriminate. And free radicals come about from normal metabolic processes. So when you're exercising, you create free radicals. When you are just walking, you create free radicals. It's day to day, every day. Everyone creates free radicals, but it's how the body processes it. It should get rid of these ping pong balls and golf balls that are going all over the place and decreasing that inflammation. So if there's damage, then the body wants to come in, repair the damage, and it creates inflammation. We want to get it out of the body. So raw foods, but the other part of it is cooked food. So some people do better with cooked, but some people do better with raw food. So depending, let's say we're dealing with constipation versus someone who doesn't have constipation. So we have to adjust accordingly. But if there's constipation, high fiber foods, so you need fiber in order to maintain bowel movements. But it doesn't matter whether you are having Parkinson's, but even in an older population or younger population, you should have fiber in your diet. And there's two types, soluble fiber and insoluble fiber. And you want both of them because soluble fiber helps feed the good bacteria or the gut microbiome that helps to make and absorb vitamins and minerals from the nutrients. And then there's insoluble fiber that helps to bulk up the stool. So you want both of them. Fats. There's good fats and bad fats. So bad fats, very simply, things like fried foods. Don't want that. But good fats, these are the ones, what I would call, I would say the easiest way to think about it is they're liquids at room temperature. So flax oil, hemp oil, olive oil. So the Mediterranean diet, think of that. So they're liquid oils, avocado oil for cooking. Coconut oil, there's a very specific one called MCT oil. So it's a liquid at room temperature. But then where it comes from is plants and fish. So having those, so wild fish, having the organic meats, having the liquid oils when you're making salads and soups, that's what you want to put, healthy fats in your diet. So other healthy fats, olive oil, MCT oil that I was saying. Fish oils, I didn't mention that one. So fish oils, we're looking for what are called the pharmaceutical or medical grade fish oils, because fish oils help to, one, decrease inflammation. And as I was saying, with Parkinson's, there's some damage, creates inflammation because the body's trying to repair the damage. The fish oils come in to help get rid of that. The other one, it also helps to increase dopamine levels in the brain. Because if you think about it, your brain is 70% fat. It needs this good fat. And fish oils is the highest absorbed in the human body versus plant oils. Your body has to convert it over two steps in order for it to be utilized. So it actually, fish oils is the best in terms of utilization. But again, pharmaceutical grade or medical grade. So these are the ones that don't have chemicals, they don't have heavy metals, they don't have any additives or coloring to it. It's what the pharmacies will make or nutraceutical companies would make, and then that's what naturopathic physicians we use. So it's not the one that you get off the shelf from Costco or Save-On. Like those are low quality. We use the one that actually comes from a nutraceutical company or pharmacy. Vegetable juices, because you want all these vitamins and minerals that are packed in there, but you want the fiber with it. So some people would juice. I'm like, good stepping stone, but a better option would be to pulverize it and keep the fiber in there so that you help with the vitamins and minerals getting to your body, but you also have the fiber that helps to prevent constipation. One big one that I tell patients is protein. So normally in the general population, I say high protein because you want high protein because I want patients exercising. And when patients are exercising, they need protein in order to repair damaged tissue. Parkinson's, not so much. You want to keep your protein levels at a lower because it can compete with the medication. You need protein for the muscles to keep the metabolism, but not too much in the body. So this is one of the times that I tell patients, hey, let's go easy on this. There are other things that we need to look at. Um, Other simple stuff, green tea. And there is green tea as a drink that you can do because you can have 3 cups of green tea, but realize that it also has caffeine in it. So don't take the green tea too late at night because the green tea has this extract in it that's an antioxidant called EGCG. So sometimes you see this as a supplement, so green tea extract. And it also has a modified amino acid called theanine. And that theanine helps to relax the body because it increases the formation of GABA, but it also, which helps with sleep. And then it increases dopamine, which is what we want in patients with Parkinson's. In terms of diet, well, I talked about food sensitivities. So depending on the person, it could be dairy, it could be grains, it could be who knows? I don't, it can be anything that shows up in a food sensitivity. It's like anything that can trigger an inflammatory reaction because it's an immune reaction, which is a food sensitivity, versus an allergic reaction. So it's not necessarily an allergic reaction, it's what's called a sensitivity or an inflammatory reaction. And then things that you can look up in terms of, I tell patients for recipes, is doing the Healing Foods cookbook or the Whole Foods cookbook. You They will have recipes in there that helps you delineate what foods would be beneficial once we figured out your food sensitivity. So we talked about protein, alcohol. It's a chemical, and when it gets into the body, it will trigger changes in the chemistry. And if you trigger that change in chemistry, it'll disrupt the functioning of those nerves. So one, yes, your mood will change, as you see anytime you've had alcohol, but two, your body then has to take time to get rid of the alcohol because it is a chemical. It needs to detoxify it. So we say, yeah, tone it down. You're never going to be 100%. You're going to celebrate your birthday. That is real world life. Enjoy the glass of wine, but make sure it has the antioxidants. So it could be a red wine, for example, which has all the tannins in it. And then processed foods that we mentioned, whole foods versus processed foods. So processed will have the additives, have the chemical, have the coloring added to it. and you want to get rid of it. So with processed foods, anything that's been washed, cleaned, milled, cut, chopped, heated, pasteurized, blanched, cooked, canned, frozen, dry, dehydrated, anything that's packaged. So that is what is called processed. So we want to get it out and we use whole foods. So the whole fruit, the whole vegetable, we want everything because we want it to be packed with nutrients rather than preservatives and artificial coloring or flavoring, because that will cause the body to slow down. But the other thing that's added to it that people don't realize until they read the ingredient list: salt, sugar, and fats, because it improves the taste. And we all know that one food that over multiple decades that perfected the ratios of salt, sugar, and fat is the McDonald's French fry. And that's why it is addictive. And it's a secret. No one knows what this ratio of sugar, salt, and fat, but they figured it out. And these fries are addictive because it has that right ratio. But we don't want that in the diet. Artificial sweetness. One question I get from patients. Some patients, you do have to use it because maybe they have diabetes. And with neurological deficits, type 3 diabetes is this term that's been thrown around, that there's a dysregulation in your blood sugar levels. So there's a dysregulation. We want to control that. So an option would be using artificial sweeteners. But they found that artificial sweetness, when it gets metabolized or broken down in the digestive tract, it becomes this amino acid that's called phenylalanine. And the phenylalanine, when it is in the digestive tract, it'll compete with a medication, the L-levodopa, and prevent the uptake into the brain. So we don't really want that happening. We want the medication to do its job. But the studies are here, there, everywhere. So no one can really pinpoint it, whether it's aspartame, sucralose, saccharin, it doesn't matter. Whether it competes with the medication and or when it's metabolized, meaning it's broken down in the body, it creates metabolites that are damaging to the nerves. They're still looking at it. They're still studying it. Some say for sure, some say not quite. Some of that inconclusive, but we still say if there's a possibility, you might want to take it out if it's not necessary to have it, because it is going to trigger stress or oxidative stress in the brain, and we don't want to. We want to eliminate as much as we can. I mentioned food sensitivities. So food sensitivities, meaning that it's not an allergy. An allergy means you eat the food, your throat swells up, your face swells up, you break out in hives, not that. Sensitivity means it's inflammatory. It's triggering another type of immune reaction called an IgG reaction. And that inflammation is what worsens the digestive tract, health of the digestive tract or the microbiome. And then your body can't absorb vitamins and minerals properly. So we, regardless, want to get it out. But there are other foods that are specifically implicated, for example, dairy. So dairy, one, the hormones and pesticides that are in it, not so much in Canada, but in the US for sure. And the other part is dairy will break down uric acid, and uric acid is a antioxidant that's found in your body that protects the brain. So if we get rid of dairy, you prevent the breakdown of this uric acid or antioxidant and thereby protecting the brain. So that's why we get rid of dairy. The other part with the hormones and the pesticides that are found within dairy, it can trigger insulin resistance. And insulin resistance are what is called prediabetes and leads to the development of type 3 diabetes, which is found in, as I was saying, in these neurodegenerative conditions, where if there's a blood sugar dysregulation in the body, blood flow to the brain is also going to be affected. And we don't want it. We want absolute great blood flow. So we're going to talk about exercise coming up being one of those things that you want to do. But if you have food sensitivities, you want to get rid of them. And people know the common ones like dairy, gluten, um, peanuts, Sometimes it's eggs, corn, shellfish. So these are the common ones that tend to show up. But I said we don't play this guessing game. You want to find out what your food sensitivity is in a naturopathic medicine. It's a simple blood test. We do the blood test. It tells us which foods are inflammatory because it looks for these antibodies or immune reactions, and then we get rid of it. Very straightforward. Nothing more to that. Another one, not so much in Canada, but it's still, I've seen it in some foods, high fructose corn syrup. And this is a neurotoxin because it has that mercury in it. And because it's a sugar molecule, it can disrupt the metabolic processes within the brain itself. And that dysfunction will exacerbate it. So again, it's not a cause of Parkinson's, but it's could be a contributor to it. But the other part of having high fructose corn syrup or high amounts of sugar in the body, again, you're triggering this thing called insulin resistance, and that increases the risk for developing Parkinson's. So we want to get it out. It's not easy to find. You really have to read the labels. Like, for example, when I've been telling patients, let's say we're on a weight loss journey because we're trying to deal with diabetes, heart disease, etc., and we go to a supermarket and look at the foods, there are a lot of foods, sausages, meats, anything, and it contains sugar, 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 sugar because this is what happens in North America. In Europe, it's way more strict than here in Canada, and US definitely not. Okay, so that's for diet. Now, looking at supplements, common supplements that are done or utilized in Parkinson's. Caveat to this, different patients on different medications and different dosages at different times. So in naturopathic medicine, we can prescribe drugs, but we also use supplements. So we know the interaction of when to use it, when not to use it with food, away from food. This is our job. Like we excel in this because we're trained in both sides to know the drugs and prescribe it as needed. So if you had strep throat, I would prescribe an antibiotic. No ifs, ands, or buts about that because it protects the body. We need to do it. But then if you're on levodopa or carbidopa, etc., medications for Parkinson's, we have to watch it in terms of supplements. So the list here, great, but a naturopathic physician will guide you as to when to take it, how to take it. Is it indicated, not indicated, based on your testing? So curcumin, strong anti-inflammatory because it is there to help get rid of the inflammation. So it works really well. The other thing with curcumin is that it helps to prevent the removal of this modified amino acid called glutathione. So glutathione, produced by the liver, and it travels through the body. Your cells also will produce it, and they are antioxidants. And antioxidants, as we said, is there to go in, repair the damage, and bring away the junk. That's glutathione's job. So every single cell is able to do it, but curcumin helps to prevent the reduction, so it keeps it longer. If you eat something that is a reparative amino acid longer, great. You benefit more from that. But the other part of it is also it prevents the aggregation of these things called Lewy bodies. So when neurotransmitters come down through a nerve, it gets to the end called the bulb. Dopamine comes out of it. When you have this protein that's in there called alpha-syn, it blocks that release of dopamine. And if you're blocking the release of dopamine, then the nerve can't do its job. Curcumin helps to prevent that. So it's shown to be a direct effect on the nerve terminals that help with dopamine production. There's a herb called Mucuna pruriens, and this one is a natural source of levodopa, but you cannot use it at the same time as levodopa because then you're having a double whammy effect in the body. So it protects the neurons, but again, depending on the person, we might or might not use it. Greens, so green vegetable supplements, we're talking about concentrated greens. So concentrated greens that have vegetables, fruits, so whether it's berries, etc., combined into one, like a powder that you can put into a smoothie. And some of them can have like 20 different vegetables, and it's equivalent to several pounds of vegetables. But there's other ones that are specific for heavy metal and antioxidant qualities and minerals. It has trace minerals in there. So that's spirulina, chlorella, wheatgrass. These are the common ones that you'd find, let's say, in a health food store. We talked about fish oils because fish oils is an anti-inflammatory, but it's also the building block for the sheaths in the brain, in the nerves. Vitamin D. So during the pandemic, um, the medical world realized that vitamin D was really important for health. It's for your immune health, your bone health, but because it increases the absorption of calcium. But then with Parkinson's, vitamin D is also a neuroimmunomodulator. So it works in the immune system in the brain. And when you have low levels of it, you need to increase the vitamin D for it. So naturopathic medicine, we do the testing for it. Vitamin D testing is not covered by MSP. So it always falls on naturopathic doctors to do it. Sometimes specialists do it, but it's still out of pocket. And we combine it with calcium and vitamin K2 because vitamin D helps the absorption of calcium into bones and muscles. So we want to always check it. Vitamin D is also important for mood. So when someone is low vitamin D, it's called seasonal affective disorder. They have low vitamin D levels. So we want to bring it up. And there's an ideal number, but depending on your levels. CoQ10. This is a supplement that is used historically for cardiovascular disease. But think of the heart, the brain, and the kidney. They work 24/7, 365. And CoQ10 is this modified fatty acid that's used by these three organs, and every single cell in your body requires CoQ10 because it is the one that powers the machinery. It's the energy generator of every single cell in your body. So things that are working 24/7, 365, the heart, brain, and kidneys needs it all the time because it helps to prevent this free radical damage. So we put coenzyme Q10 into the patient's supplement regime because it is able to get into the brain, get into the nerves, and repair that damage. It's not just the heart. People always think of CoQ10 used for heart disease, but think of the brain also as that thing that requires CoQ10. Vitamin C, vitamin E, these are important antioxidants that people know of historically, good to use as well. There's a modified amino acid called N-acetylcysteine, and N-acetylcysteine is a sulfur molecule. It goes into the liver and it's used to make that a modified amino acid that I talked about called glutathione. And when you have glutathione, that helps to repair damaged tissue. So in patients with Parkinson's, the glutathione levels they've measured are lowered. So if you give the person N-acetylcysteine, the building blocks for it, you can improve the glutathione levels. But N-acetylcysteine um, has to be processed in the digestive tract in the liver. So a way to bypass that is to do intravenous glutathione because it goes directly into the veins, right into the body, and it's delivered straight to the tissue because glutathione helps to get rid of those free radicals. Whether that free radical is due to normal metabolic processes or is it because of environmental toxins, it doesn't matter. We want to neutralize those um, oxidant molecules. And by default, as you get older, you produce less and less of this glutathione. And in that part of the brain that's involved with Parkinson's, substantia nigra, those nerves are lost because there's decreased glutathione. So if we put it back into the system, and best delivery is intravenous, then we can negate future breakdown. Another supplement whether oral or intravenous, that's used as a modified fatty acid called alpha lipoic acid. And same thing, this one, we use it in diabetics. We use it in patients with strokes, patients with Alzheimer's, Parkinson's. It helps to work as a strong antioxidant, but it also protects the nerves against damage. And if you combine it with this other amino acid called carnitine, so acetyl L-carnitine is specific for the nerves. There's another amino acid called, a modified amino acid called L-carnitine without the acetyl. That one is for fat metabolism. Acetyl L-carnitine is specific for the brain and the mitochondria in the brain, in the heart, in all the powerhouses, the cells in your body. So if you combine the two, it actually increases the effectiveness. So it's a multitude effect rather than working separately. You combine it together and it increases that mitochondrial activity and decreases that reactive oxygen species. A new one that's come out, I shouldn't say new, we've had it around for a long time in naturopathic medicine. We used it in patients who are coming off of recreational drugs, so patients who have a drug addiction. NAD is a modified, is an activated form, I shouldn't say modified, activated form of vitamin B3. And it's an intravenous treatment that we've been using for quite a while, but somehow during the pandemic, it became popular. I don't know why it became popular. I think it's just for brain activity, brain functioning, because NAD is, again, one of these, it's a B vitamin and it's used by every single cell in the body. And they found that if you give the NAD, it reduces the tremors, increases the mobility, their mood improves, their thinking processes improves, and they overall have a better quality of life. And because it's a activated form of vitamin B3, you always give it with the other B vitamins because the B vitamins work in concert with each other. There's 8 B vitamins. You can't give one without the other. So a common one people do is vitamin B12 if they have low energy. But the B vitamins work together to help you improve mood, help you make your neurotransmitters, help you make your hormones. It's extremely important you use all of them. So always a B complex, never individual B vitamins, because there have been some studies that talk about vitamin B1 in neurodegenerative conditions, vitamin B3, which is this NAD, but then there's other ones that help with nerve functioning. So vitamin B9, which is folic acid, and B12. Always give them together, is what I'm getting at. Amino acids, we're trying to increase dopamine formation in the body. So there's dopamine and there's other neurotransmitters like GABA that helps with sleep, acetylcholine that helps with activity of the muscles. So there's multiple neurotransmitters in the brain, and they come from amino acids. So amino acids, the breakdown products of protein, and tyrosine, tryptophan, serotonin, they're all required by the brain, and we can give them intravenously. But again, careful. If someone is on levodopa or carbidopa, or one of the Parkinson's drugs, we have to monitor the patient and make sure we're not ramping up too much of a good thing in the patient. But that's our job, naturopathic medicine. We know what to do at that point. New thing, again, that came out sometime during the pandemic, if I'm not wrong, as well, was psilocybin because it improved motor symptoms, mood, memory, activity. So y- microdosing is what's called, not legal, not in Canada, um, but there are places that have microdosing of psilocybin, but it's been experimental. Like there hasn't been conclusive studies for it. The other one that I didn't put in here that I was thinking about it today, um, that is in the last year, are these things called peptides. And peptides are longer chain amino acids, and they're used in the States, but in Canada, we don't have access to them. But it's still experimental, so they don't know yet conclusive. Is it going to help, not help? So, what do we do with patients? There is a combination. It's not one thing that's going to help. And there was a study that looked at patients using vitamin D, the B vitamins, vitamin C, fish oils, but then there's other ones like the NAD, vitamin B9, the CoQ10, the curcumin, and then the hormone called DHA, which is also not available in Canada unless you have a prescription from a medical doctor. Um, and they had better outcomes. So it's not one thing that's going to help, it's a combination. But what determines that combination is going to be dependent on your symptom, your medication list, your changes in your health. And we need to figure that out because it's like a jigsaw puzzle piece. I said we need to put it together and then figure out what needs to be done. Exercise. So some of you are working with physiotherapists and they've said, will tell you exercise helps to improve cognitive health because by default, when you are exercising, you're increasing blood flow to the brain, which protects the brain, flushes out the brain, the neurotoxin in the brain increases production of new neurotransmitters in the brain. So they improve their cognitive health. And that's what we want. So, working with a physiotherapist, they will tell you how to work in terms of how to walk, how to do things, but it's all about movement rather than just sitting still. They are there, their job there is to help you with that. Massage therapists or osteopathic practitioners will help you with the muscles. Some patients have done Tai Chi because it's been studied in China to help with coordination stability because it's very slow, purposeful movement that helps the person in terms of balance and coordination. Water aerobics, I always say aquasize, going to the gym where there's a swimming pool because it's zero impact with aquasize or low impact, and you're moving your body. So you don't have to go running. It's not your like classic exercise that you need to do modified exercises. Your physiotherapist, your massage therapist, osteopathic practitioner will help you with that. And then the last thing that we do in naturopathic medicine is acupuncture. Again, used for centuries. And this is more to deal with the symptoms that you have, whether it's pain, muscle stiffness, anxiety, difficulty with sleep, it is all there to improve the energy flow in the body. That's what Chinese medicine looks at it, or preventing deficiencies in different organ systems. So when they say kidney, liver, spleen, blood, this is not your traditional Western medical view of it. It's the Chinese medicine view of it. And when there are blockages or there's this thing called phlegm or wind, that's when you start having problems such as the spasms, the stiffness, etc. And in naturopathic medicine, we do acupuncture as well, and we use Chinese medicine to help with those symptoms. So using Chinese herbs, using acupuncture, and there's very specific acupuncture points that are utilized. And some of them are listed here. Some of them, let's say gallbladder, the first one, gallbladder 19 is up here, but then gallbladder 34 is on the outside of your lower leg. 38 is way down lower. GV13 is on the back and the spine. So it's in different areas that you might not think it's related, but in Chinese medicine or in naturopathic medicine, we would look at your tongue, look at your pulse. So Chinese medicine and or traditional Oriental medicine, Asian medicine, and we work with that. We use acupuncture needles to help in that. So whether it is the stiffness, whether it is the tremors, whether it is the pain, this is our job. We're trying to figure out what is happening in your body and then correcting it. That is our job. So multiple points, like SI2 is right on the side of your hand. It can be anywhere in the body, but it's specific to you. So classic naturopathic medicine or Chinese medicine with acupuncture, it's specific to you that's different from someone else. So overall, in Parkinson's, our job is to decrease the symptoms and to try. So, in decreasing symptoms, how we do that is by decreasing inflammation, decreasing what is called the oxidative stress, improving your dopamine levels, getting rid of any. waste products, so metabolic waste products, or pesticides or neurotoxins, things that are damaging the brain. Because if it is a genetic factor, we can't change that. But what we can do is to manage the symptoms and prevent further degradation. So whether we do it through diet, whether we do it through supplements, whether we do it through um, yeah, fatty acids, or whether we do it through intravenous treatments or amino acids or glutathione or alpha lipoic acid. There's so many options available, depending on the patient. And we work with the other medical professionals. So in the medical system, you would be prescribed certain drugs, naturopathic medicine, the supplements, and then you're working with your physiotherapist, your massage therapist, your osteopathic practitioner, whether in naturopathic medicine we're doing acupuncture, whether you're going to a acupuncturist, so someone who is just working in acupuncture and Chinese medicine, it's a team approach. It's not one person over the other. It's a team approach that helps the person make it through, and that gives the best outcome. The studies have shown that it's not just one thing, it's a multitude of things that help a person or a patient. And that's it from me.